So I'd say accessing treatment for myself compared to my daughter is very different. Because when I was younger and diagnosed with asthma, I used to get treatment from government hospitals, and she now gets it from a private care facility. So when I was younger, government, you don't pay anything. Also, the difficulties we used to encounter when I was younger, you would go to the clinic or the hospital to get the medication, and you'd find out that the medication that you used the previous month, they're not going to give it to you because it's not available. They'll rather give you like a substitute, I believe, or any other medication that they have at the time. And with my daughter, she has private care, or I would say health insurance. Although the treatment is effective, but with regards to the cost, it's too much. Although I have medical insurance doesn't cover everything. You'll find out that whatever her script. So let me give you an example of her script. So her script, she has a controller pump, a reliever pump, an allergies medicine, and an allergies spray for her nose. So we both have asthma and we have sinuses, allergies. So for her script, it has 4 things. So it's the reliever, the controller, the medicine, and the nasal spray. In all of this, the only thing that is covered 100% is the reliever pump for her. The sinus medication, the medicine, is not covered at all from the medical. The nasal spray is covered. Let me calculate the math. I'll say it in percentages. So I'll say the nasal spray only covers about 30% of the price of it. I'm talking about every month. So the 70% I'll have to pay from my pocket or my medical insurance savings, which is already depleted. We're already in May, it's already depleted, so it's coming out from my own pocket. And then her controller, which is the one that she takes every day, the morning and the afternoon, they cover 50% of it. So I have to pay every month 50%. So those are the costs with medical insurance. I'd also say with my medication as well, we are similar. I also pay parts of my medication. Not all of my chronic medication, which I collect every month, is paid by medical insurance. So I'd say the difference between when I was younger, getting medication from a government hospital, and now since she's getting medication from medical insurance is different. The disadvantage in my when I was younger is that I didn't get the medication that I was supposed to get. I used to get alternatives, even if it's not the medication that was prescribed for me, and she can get all of it. Although it wasn't costly for me, it's costly for her, although she's getting the best medication she can possibly get right now. So I think when it comes to finances, it's very difficult. It's very difficult, and it's actually a need. What I find very difficult is the fact that you pay this medical insurance every month for giving you the best possible care, health care, and you also have to pay additionally every month with paying this insurance. I wonder how the system is now with the government. I also want to just go check and dab in and see if everything is proper now, so I can maybe change my daughter to there. Although it is a risk, but I just want to find out and see how's the government medical system now with regards to medication of asthma.